Hello, I'm Paula Hull. I'm Director of Nursing and Allied Health Professions here at Southern Health. I'm really pleased to be here today to talk to you about the Carers Peer Support Programme. Without our carers working with us in the NHS, we would not be able to deliver the amazing care that we do to people every day. We are developing some roles within our organisation of people who have been carers and have experience of caring for their loved ones to come and work with us and to help us to make sure that we identify support for people when they need it, that we involve them in the care of their loved one, and that they help us to shape some of our services in the way we need to make sure that carers are really, really central to everything we do.
Hi, I'm Ali.
Hi, I'm Chris.
We're carer peer support workers for the Community Perinatal Mental Health Team.
Hello, my name is Elizabeth and I'm a carer who has been supported by Ali. My daughter became ill. She'd had a baby the previous year and had postnatal depression, and it came back in 2020. I had to go and move in with her as there was no other way. So I found myself as a carer to my daughter, my son, my grandson, living in a house where my son-in-law was trying to work as well. So I was there 24 hours a day, 7 days a week. It was very lonely. I had a lot of criticism from friends who said I was breaking the law by not being in my own home. Others said, oh, you're lucky you're seeing your grandchild, which was very hurtful, and I realised none of them really understood what I was going through. It was suggested by the perinatal mental health team that I should access Ali. First I was reluctant, feeling that there were far more cases who need help than me. And then after a week or two I realised that I had no support for me. And if I was going to continue, it was important that I kept well. So yes, I agreed. Put Ali in touch with me, and I just sat nearly for the whole hour and cried on the phone to Ali. But it was a catalyst for getting some help. Ali had been fantastic on the phone then. I knew that she would listen without judgment. She had some empathy. Just being able to talk about my feelings, about me, rather than what I was going through with my daughter, really.
I was working in Asda and I was on the tills, and I decided the week before that I needed to do something else, and a customer came through and she was talking about her job, and it was in mental health, and I was like, wow, I was saying, you're really lucky, I wish I could do something mental health. And she said, well, you can. I said, well, I haven't got any qualifications. So she said, well, have a look on the website, there's lots of positions. So I had a look, and by chance that week this job came up. All we needed was to have lived experience in mental health when my daughter had been poorly, so I applied. So carer peer support workers support the people that are looking after patients with mental health. we see people one-to-one. So we might meet them in the community or over the phone or on video, and they just talk to us and we listen, and we provide support in that way. We also run groups, so we sort of have groups by theme. So perhaps we might have a nursery nurse come along and talk about babies. It's mainly partners that we support, but we also have some mums of mums and maternal grandmothers. So they come along and they can ask the nursery nurses anything they like.
Carers peer support work is a really exciting addition to our healthcare model. As we know, anyone who's going through a health struggle, a health battle, their family are really involved. A carers peer support worker is assigned for exactly that, the family members, the loved ones, the carers of someone who is a service user, and they can provide emotional support, advice, and they really help to smooth the way of a healthcare journey, to really help individuals ask questions, understand and provide insight based on their own experiences, so service users and their families can make informed decisions about their healthcare pathway.
I've got a couple of carers who literally come on the phone, talk non-stop. They don't need me to say anything, and they say, "Oh, I feel better now."
Yeah.
And then they go.
Mm-hmm.
And that's like interesting, isn't it? How different people
It's an emotional
need
download,
different
isn't it?
things. Yeah,
Yeah.
literally. They don't need me to say anything.
Yeah.
They just need someone to talk to.
And then whereas other ones that I've worked with, I've set them homework to learn to boil an egg, and I've set them
Have you
homework
literally?
to go
Yeah.
and read a book for 1 hour a day,
Yeah.
and you know, things like that, things that are practically helping them, things that are helping them with their own well-being, helping them to relax and have time to themselves.
I'm just so grateful to Ali that she was there when I needed her most. I'm just so incredibly pleased that someone had the foresight to actually create these posts to help carers. I just think they're so vitally important. Without it, I don't know where I would have been in 6 months' time, probably needing support from a mental health team somewhere else.
I can't overemphasise the difference that they are making, and it comes home to me when I do the carers groups that we run for the Trust, and when I hear carers talk about how they are being involved in meetings about their loved one, about how they are being asked to put their expertise and how they feel recognised for the incredibly difficult, challenging jobs that they do every day. You know, we pop in and out.
And so what's the future for Carer Peer Support Worker Programme?
The future for Carer Peer Support Programme is grow. We want more, and we are 100% committed to getting every carer in Hampshire linked in and supported.
And what would you say to someone that might be interested in becoming a Carer Peer Support Worker?
If you're already thinking about it, then you're probably the right person for it.
What would you say to a carer that's in your position, who was in your position? What would you say to them?
To seek help. It's so important that you keep yourself well